Dr. Robert J. Keller is board certified in immunology, hematology, and oncology. In addition to his medical practice, he has had a distinguished career in medical research and was named one of the 2,000 outstanding scientists of the 21st century. He has served on the faculties of the Mayo Graduate School of Medicine, the University of Wisconsin Medical School, and other medical colleges. He's also served on the scientific review panels of the National Institutes of Health and the Veterans Administration. He has authored more than 100 original peer-reviewed research articles published in various medical journals. Today, he directs the medical research at Phoenix Biosciences, and at his clinic in Hollywood, Florida, treats patients with diseases of the immune system, blood diseases, and cancer. Here's a segment of Steve Scott's recent interview with Dr. Keller.
So let's start with the immune system and the role that glutathione, or GSH, plays in our immune system.
Each cell in your body, and it's not just your immune system, it's virtually every cell in your body, from the top of your head, including your brain, to the tip of your toes, has to create ATP, which is a substance that is used for energy. That involves a whole series of chemical reactions. That's the good news. The bad news is we're oxygen-based organisms. We live on oxygen, and oxygen creates a fire, and that fire is called an oxidant. And in order to put it out, you need a very good antioxidant. Now, many antioxidants work for one thing, or two things, or three things. Glutathione works for everything.
Tell me about what happens with our glutathione production as we age.
As we age, the old data tells us that it decreases by about 10% a decade or 1% a year. I think that data, however, is very much outdated. Given the stressful environment we live in, the polluted air we breathe, the less than wonderful food we eat, and the fact that 70% of the American populace is sleep deprived, I would suggest that glutathione levels decrease much more rapidly than is projected in the literature.
What does the drop in glutathione do to our body?
Well, it's very simple. If, in point of fact, glutathione is responsible for putting out the fires so your body or each cell therein can produce a maximum amount of energy, as that glutathione decreases, so does the energy production from each cell in your body. Not only that, but you wind up with increased amounts of what are called oxidants. And there's very good data in the literature to say that oxidation, or too much oxidants, if you will, or not enough antioxidants, are really responsible for accelerated aging.
So what you're telling me then is glutathione levels go down, I'm going to actually age faster than I would if they were up to an optimal level.
Oh, absolutely. Your body works as an electrochemical circuit. And the fact of the matter is this ATP, this energy substance that's produced by little furnaces in each cell in your body that are called mitochondria, are responsible for each cell functioning maximally. Well, if your cells are functioning at 50% of maximum, clearly, okay, the problems attendant with that is you lose energy, you lose the ability to exercise, and all the other things that have been talked about with regard to aging.
Does GSH play any role in my body's ability to fight off infection or disease, or even, I've heard, for example, that heart disease today, they're telling us, is as much a function of inflammation as it may be from other causes.
Absolutely true. There was a researcher 30 years ago who posited that inflammation was really responsible for heart disease. And unfortunately, that was rather shunned by the medical community until 2002, when it suddenly became, oh, well, we forgot about inflammation, and it really is important. So anything that will decrease inflammation will protect things. Now, let's define what I mean by decreasing inflammation. Inflammation comes from too many of those oxidants, those burning factors, that are not countered by antioxidants. And again, glutathione being the top of the antioxidant chain, it's the one I'd clearly like to have the most of.
Now, what makes Max GXL different from other similar kinds of products?
If you Google glutathione, you will find that 80% of the products are actually glutathione themselves. That's a fallacy, because if you ingest glutathione, it will be broken up into its component parts by the acid in the stomach and will never get into your body in a form that your body can use it. The fact is, we spent 3 years doing a number of experiments to find the appropriate ingredients at the exactly correct amounts to allow it to, 1, get through the stomach, 2, be preferentially absorbed, because not everything you put in your mouth gets absorbed into your body, and 3, and this is the real trick, it has to get through 2 membranes. One is at the entrance to the cell, and then the second one is into this furnace called the mitochondria. And so we created a very unique formula, which, by the way, was given a composition patent, which is usually reserved only for ethical drugs, that would promote absorption, get it to where it should be, and say to the body, you can do anything you want with it, but oh, by the way, the easiest thing you can do, and the body will always take the path of least resistance, is to make glutathione.
And you've actually done blood tests on groups of patients that have shown the difference before they get on this formula and then after they've been on it for anywhere from 3 to 6 months.
Yes, we have. And we developed a proprietary test that measures glutathione in lymphocytes. So it's real-time data. And the fact of the matter is, using that test, we did normal basing, which I think is probably low, and then we did patient groups. Found the patient groups was significantly decreased, and after being on Max GXL for a period of time, sometimes as little as a week, but it continued to increase over months, not only got to normal, but got to higher than what we found as normals.
Now, how does it create such a jump? I noticed, for example, on the normal patients, in the test that we have on our website, it went from a numerical value of around 123 all the way up over 300. I noticed that on your HIV patients, it went from a numerical value of 48 to 200. That's a 400% increase. What is actually happening that causes that kind of an incredible increase?
Well, there's another little wrinkle with Max GXL that is not present in virtually any other product. And that is, not only do you get to make glutathione, once the glutathione is used up, taking care of one of these little fires, it's regenerated, so the body can use it again.
How does it do that?
Because a number of the substance we put in, and I'm not going to go through the molecular chemistry of it, in essence take the spent glutathione and remanufacture it.
Wow. Give me just a summary of the benefits. I know what I've seen, okay? And I had a major inflammation problem that I don't like to talk about because it's very personal. And I saw an incredible result with that after 20 years of having this one particular problem. And, but give me some of the general things people can expect when they get their glutathione levels back up.
Rather than give you a list of what I think, okay, I'm just going to tell you some of the things the patients have told me. Because this was created because of the patients in my clinic. It was not an ex vacuo idea. It was really predicated on real people with real problems. These are the things that they've told me. Suddenly my energy is back to where it used to be. Gee, doc, I'm starting to think like I used to do. Gosh, when I go to the gym now, I can actually work out, because one of the things that's not well known is that in the first 10 minutes of aerobic exercise, you burn 40% of the glutathione in your muscle. In the same kind of fire reaction that we're talking about for anything that goes on in your body. And if you don't have a way of replacing it, you're in trouble. You're not going to have good exercise. Soreness is created when you expend what is called the oxygen debt in your body. Basically, you can't make the fire anymore because the antioxidant glutathione is gone. So the body converts to what's called anaerobic glycolysis. Big name, simply means it burns sugar without oxygen. It results in the accumulation of lactic acid, and lactic acid is the thing that hurts after you work out. So by increasing the glutathione, you decrease the lactic acid, and by doing that, you can work out more frequently because your muscles recover quicker. The more ATP, the more energy the cell can produce, the better every cell works. Whether that's a brain cell, a muscle cell, a heart cell, a liver cell, it really doesn't matter. So his springs are muscle cells.
Right.
So if you increase the efficiency of those cells by decreasing that oxidation, that burn, by increasing glutathione, sure, they're going to work better. Now, I'm not going to tell you this is a magic pill and that it's going to take care of everything. But the fact that it works in every cell in the body and the fact that it can increase the energy production, which is basically functionality for that cell, is obvious to me that it's going to work in virtually any condition. I'll give you a perfect example. There are a lot of patients in the United States with chronic obstructive lung disease caused by smoking and bad air and a number of other things. This doesn't treat it, but it will do two things. One, it will decrease the inflammation in the lungs so that in point of fact, they can work better. And as importantly, one of the problems with chronic obstructive lung disease is that the lungs get stiff and the muscles in your ribs have to work harder to get the air into there. Muscles work on glutathione. So by improving the lung function and improving the muscle function, you're not going to make the illness go away, but you're certainly going to improve the quality of life of people who are afflicted with that illness.
So let's talk about, then just in summary, some of the benefits. Number one, we know a raised glutathione level will slow down the aging process. Diseases of aging, tell me about that.
Well, again, diseases of aging to a large extent are inflammatory. If you look at Alzheimer's, if you look at cardiac disease, if you look at Parkinson's, if you look at stroke, all of those have a major inflammatory component. Now, I am not sitting here trying to tell you that glutathione solves those problems, but by reducing inflammation and reducing the amount of oxidants in the body, which subsequently reduces inflammation, it does have a protective benefit. It is not a treatment, however.
Right. Now, one thing that I've noticed, and you can tell me if it's a coincidence or if it's because of this, but during the last couple months while I've been on the product, I used to have an energy slump around 2 o'clock, and I'd be fine. I'd eat a lunch, 2 o'clock, I'd go down, and about 4:30 I'd start to gradually come back, and I'd come back to maybe 70% of where I was in the morning, and then fade off during the day. From the time I wake up until the time I go into my room to go to bed, my energy level is straight across. I don't have any slump. Even if I have a big lunch, I don't get tired anymore. I mean, coincidence?
That's not a coincidence at all. It's also the reason that I always take Max GXL after lunch.
Okay. Oh, okay. Now, here's the other, and I do too. That's what I take. I take it in the morning, then after lunch. The other thing I've noticed is that I've recently went back to my hometown of Philadelphia and was talking with my best friend. And one night we talked till 2:30. The next night we talked till 4 a.m. And I thought, the night we talked till 4 a.m., I thought, man, I am in so much trouble around 2 or 3 o'clock tomorrow. I'm just going to crash. And the crash never came. I mean, it was as if I had slept a full night. And that's one of the most amazing things to me, because I notice that every single day I've got this energy level that I've never had before.
As I define it to my patients, I'm not interested in your only having energy for work. Do you have enough energy to play? Because that's really important for the well-being of a person.
I understand that a lot of your patient load is HIV, hepatitis, what else? Chronic fatigue syndrome. I mean, that's got to bring you down just dealing with that level. Are most of your patients, have you been able to get them on this product? Or?
Oh, they're all on it. It was developed for them.
Okay.
We also deal with people who are undergoing chemotherapy for cancer, because chemotherapy also markedly decreases the ability of the immune system to function. This, in fact, will allow the immune system to function almost normally. Wow. It certainly does in the HIV patients, and it doesn't bring me down, because the fact of the matter is my patients do very well.